Good afternoon, I'm Mikell, and thank you for choosing Across the Fence. Medicare is the federal health insurance program created in 1965 for people ages 65 and over. Today, Medicare plays a key role in providing health security to some 60 million older Americans and younger people with disabilities. Unfortunately, Medicare is also an attractive program to criminals. Medicare loses billions of dollars every year due to fraud, error, and abuse. Medicare is cracking down. It's using its state-by-state Senior Medicare Patrol, or SMP program. SMP helps educate and protect recipients, detect fraud, and report concerns. For Vermont, the Senior Medicare Patrol program and its trained volunteers can help with questions, concerns, and complaints about potential fraud and abuse. So today we're going to learn more. We've called on Michelle Kessler. Michelle is the director of the Senior Medicare Patrol program in Vermont. Michelle, good afternoon. Thank you very much for being with us.
Yeah, thank you for having me.
So a lot of people, they might be hearing about this phrase Senior Medicare Patrol for the first time. So what is it?
Medicare Patrol is a organization and a federal grant that was established 20 years ago to educate Medicare beneficiaries, healthcare providers, their families, care workers, on how to protect, detect, and report Medicare errors, abuse, and fraud. The system has about, over $65 billion a year nationwide of errors, abuse, and fraud.
So that's federal fraud that we know about. Even your website acknowledges that we probably don't know the full extent of the problem. But this SMP, Senior Medicare Patrol program, is designed to help stop that. So what do we know about fraud or errors or abuse in Vermont? What's our track record?
So right now we're dealing with about 100 cases, and that is starting as of January. We've expanded our program. I don't think we have 100 cases because we have more cases. I think we're just getting the word out there for beneficiaries to report these errors, abuse, and fraud. Errors are very easy to handle. I mean, it could be a double billing, could be maybe they billed the wrong person. And
sometimes it could be intentional, sometimes it's maybe not intentional.
So if it's intentional, that would fall into the abuse or the fraud column.
Yep. So you started to, and I interrupted you. Give us an example of the types of fraud, the types of errors that can occur. I'll get to fraud in a moment. What can happen with errors?
Well, an error, for instance, if a beneficiary, and this is why we do recommend beneficiaries to carefully review their Medicare summary notices. If they have a Medicare Advantage plan, it's an explanation of benefits. They come quarterly, and it's important to review those because you could have a double billing. Medicare's not going to know if you received 2 procedures or not, but the beneficiary will know. And we can usually call the doctor's office or the healthcare provider and get those charges reversed fairly easily.
You gave me an example of somebody, I think, that didn't really know their quarterly statement, and when you pointed it out, they looked and they found an error. The problem is, when an error is found, it's usually too late to do something about it?
No, not necessarily.
Good.
We have a beneficiary from South Burlington that called, and she apparently was in the hospital in Dartmouth, which obviously she was not in Dartmouth at that time, and the charges, she noticed them because she went to one of our presentations. So she went back and looked at all of her summary notices. These charges were actually a year ago, and we were able to call Dartmouth-Hitchcock, we were able to call the x-ray labs that did the billing, and we were able to get all those charges reversed.
So now that I wanted to come in, fraud is much different than an error. So what does fraud look like in Vermont? And I know that working here in the news department or watching the Channel 3 News, we do see these cases that come up. But again, what's fraud look like when it comes to the Senior Medicare Patrol?
Well, the biggest fraud that happens are the phishing calls. Those are those calls that people will get, and they'll say that they're from Medicare, and then what they're doing is they have very clever ways of getting those numbers.
Yes, they do. They're very sophisticated.
Yeah. They'll say they're from your doctor's office. They'll say they're calling from Medicare. The bottom line is Medicare is never going to call you. Repeat
that, please.
Yeah.
Medicare
is not going to call you. If you get a call from someone saying they're from Medicare, you just hang up. If you get a call from someone that says they're from your doctor's office, hang up. Call back your doctor's office. That is a trusted number that you know, and you know you're actually speaking to someone at that doctor's office. not a random caller.
And these are great tips. One of the other pieces that, again, in conjunction with what you're talking about on your website, it's very clear, protect that card, protect that number.
That card is your medical identity, and fraud is essentially medical identity theft. When we file reports with the Office of the Attorney General on fraud cases, one of the things we click is medical identity theft. So that ID is very important, and when it's been compromised, it's really important to contact us and to contact that number on the back of your card. It's the 1-800 Medicare number.
Okay.
Report that compromised card.
All right. How do you know that I keep messing up the acronym
That's
here.
okay.
The Senior Medicare Patrol, how do you know it's effective?
As of now, I think we're very effective. When we go out and do a presentation, we could have 6 people at the presentation, we could have 50 people. But one of the things that we do at every presentation is we have them fill out an exit survey. One of the questions on that exit survey is, do you read your MSN statements? Those are the Medicare summary notices. And I would say 90% say, circle no. Will you read them in the future? And we have about 80% saying yes. That to me, I think is very effective in getting the message out of how important it is to really protect your Medicare ID and to read your summary notices.
And this is the example you were giving of a recipient from South Burlington who came to one of those seminars and learned something.
Exactly.
The SMP program, as you pointed out at the beginning, is federally funded. Every state has a program, but they each operate a little differently to give some flexibilities to the state. In Vermont, our program is administered by COVE, which is the Community of Vermont Elders. What do you want viewers to know about COVE and SMP?
So Community Vermont Elders is an amazing organization that advocates for older adults. We work with legislators to educate them on legislation, potential bills coming forward that affect our older citizens here in the state. And one of the examples was we were heavily involved in getting hearing aid coverage in Medicaid. Those are the most vulnerable who cannot afford hearing aids. Medicare does not cover hearing aids, so if they're a dual eligible person and they qualify for Medicaid, those individuals will now have access to be able to get hearing aids.
So there is a way to contact the SMP. There's a website and there's also a toll-free number. I'm going to turn that over to you to tell us a little bit more about what would happen if I, for instance, visited the website or tried to report something.
Yeah, so the best way to get in touch with the Senior Medicare Patrol here in Vermont is to contact 802-229-4731. We also have a form on our website, and that's vtsmp.org. The person answering the phone is probably going to be me, or it could be, we have some other fabulous volunteers and staff at our office, and they're all there to assist you.
In the time we have remaining, we're joined by another guest with important additional information about Medicare. Sam Carlton is the director of Vermont's statewide health insurance assistance program. It's also known as SHIP. Sam, thank you for being with us.
Yeah,
Good
thanks for
afternoon.
having me.
What is the main role of SHIP? Again, it's the State Health Insurance Assistance Program. What's the role?
That's right. So SHIP, similar to SMP, is also a federal grant. We are housed at all the 5 area agency on agings in Vermont. The role of SHIP is to educate people about Medicare, as well as to do plan comparison and help people understand enrollment periods.
So unlike fraud, abuse, or error, you might be helping me transition when I turn 65.
Correct. This is more the nuts and bolts of Medicare. Yep, the day-to-day stuff.
And there's lots of questions. I'm not there yet, but I do understand things can be complicated.
I like to call it a quagmire. We help people navigate that.
Now, when it comes to Medicare, you tell me October is an important month. So why is that?
Correct, yeah. So the annual enrollment period, also known as the open enrollment period, runs from October 15th to December 7th. And that's the time of year where Medicare beneficiaries have the opportunity to compare and select their prescription drug coverage for the upcoming year. So
this is the window, and again, repeat that. When is the time frame, and I'll follow up with what happens if I don't do what I'm supposed to do in that time frame.
Yep, so again, it's October 15th to December 7th.
Okay, and what happens if if I'm not following the regulations? What happens if I realize on December 30th, oh, I should have done something?
Yep, so you want to pay attention to mail this time of year, really late September into October. That's when your plan has to send out what's called the Annual Notice of Change Letter, or ANOC, as well as information from the federal government if you receive extra help, or from the state if you're on state assistance programs. These will tell you changes to your plan, and so you'll want to pay attention to those. If you do nothing, if you elect to do nothing, you'll stay in the same plan you had from the year before, or if you're on one of those assistance programs, you may be auto-enrolled into a different plan. So this could impact, getting your meds, costs, pharmacies that you prefer, all those things.
And Sam, so that I'm clear, you're now talking in terms of this enrollment period, you're talking about folks that are already eligible and are Medicare recipients because
Correct.
They have a plan, whether it's original Medicare or something else. So this is applying to thousands of Vermonters over the age of 65.
Yeah, there's around 150,000 folks on Medicare in Vermont, so roughly a quarter of Vermont's population. We're an older state, so it's a lot of folks. Yep.
Well, so we're now into October, and people may have questions. If they do, can they call your office? How could I learn more if I am wondering about changing or updating some part of my plan?
Absolutely. So you'll want to reach out to us at SHIP. Our toll-free number is 800-642-5119. And as I mentioned, we are at the 5 area agency on aging, so each corner of the state. That 800 number directs you to your local office. It grabs your phone exchange and pings you right there.
And these are trained folks, much like we learned with Michelle and SMP, that the folks who are, well, she said she'd be there to answer the phone. I don't know that you are, but those folks are going to be able to answer our questions.
It won't be me, but no, every area agency on aging has SHIP trained staff that will be there to take your questions. Some volunteers in some offices, but yeah.
Well, Sam and Michelle, I've learned a lot today, and I hope it was important to our viewers, whether they're already enrolled in Medicare or maybe like me getting a little bit closer. These are very important issues, and I want to thank you both for being with us today.
Thank you.
Yeah, thank you.
That is our program. We know you have choices, so thanks for choosing us. I'm Will Mikell, inviting you to join us back here each weekday afternoon for another visit across the fence.